We want to make this as more of a concierge experience as we possibly can for you. So in our Zoumalan bag, you're going to find a lot of items that are going to be very helpful for your recovery. We'll start with the pre-op medications. This is a product that I've developed, and in light of developing and needing the most advanced arnica-based product for healing, this is Skinuva Brews. You're going to start taking this 1 or 2 days before surgery, 2 capsules a day. This will help in your recovery, help prevent bruising, help in your discomfort and swelling. So that's Skinuva Brews. That's included in your bag. And after surgery, you're going to be immediately starting to ice and cleaning your incisions. It's normal to have a little bit of oozing. So we prepared some sterile gauze for you that you'll place over your eyes, and then with the frozen bag of peas that will be placed on top of the gauze. That you'll be doing the first few days. Gauze is here. Gauze is also used to cleaning off some of the oozing that you have. Q-tips. Sterile Q-tips are great for applying ointment to the incisions if you have any upper and lower lids. And this is the sterile Q-tip, should last you for the week. Included is an antibiotic ointment, erythromycin ointment. You also will have eye drops in most cases to use for your healing. This is a steroid and antibiotic drop that we'll be give you as well. When you place the eye drops, your caretaker will just have you lean back, just open your eyes and place a drop in your eye. Do not lift. If you had lower lid surgery, do not lift your lower lids down. If you had upper lid surgery, do not touch your upper eyes. So my best advice is just keep your eyes open and just put the drop in there, and that should do the job. All right. In cases where we expect some swelling to occur, we often recommend a low dose steroid. It's called a Medrol dose pack. We do recommend this in many of our patients, so that really helps in the healing. If you have a little bit of nausea, which is not common, but in case you do, we have immediately provide Zofran for you. Antibiotics in certain cases, if we need antibiotics on board, we'll give antibiotics as well. This is not on every surgery, so it just depends on what you're having. Pain is really not a major issue in our surgeries, thankfully, but if you do have some discomfort, we have backup Tylenol with codeine, for instance, that can really help with your discomfort. Again, most patients don't really use this. They usually do great with just extra strength Tylenol. We're almost there. Artificial tears. If your eyes feel a little gunky, they feel a little bit blurry, they're teary, they're dry, we provide artificial tears as well for you. And then we already went through it. And lastly, if you're having a laser, CO2, or microneedling at the time of your surgery, we'll give you Skinuva scar cream at the same time to help in the healing process. It's important to note that when you place this, don't place it on the eyelashes. Just keep far away from the eyelashes, just in the lower eyelids. If you had lower lid blepharoplasty and you have those bolsters, just make sure you can kind of just gently put it around the bolsters, but don't get it too close to the eye. If it gets into the eye, it's not terrible, it's just a little irritating, so we just recommend you to use artificial tears to get it out. Now, keep this, because after I remove your sutures, you'll still be using this as a scar cream, and we'll give you instructions on when to start using this after suture removal. And lastly, this is not for drinking. This is actually purified water that we provide, so you can use this to wash your eyes and face for the first 2 days. So we do not recommend you to wash your face for 2 days. So if you need, or wash your face with tap water for 2 days. So if you need to, just use this with some gauze to clean off your face, clean off your eyes. On day 3, you can certainly shower like you normally do. Keep your eyes closed. Let the tap water in the shower run down your face. You can use shampoo and conditioner at that time without any issues. So I just want to emphasize that this kit is one of the ways that we prioritize patient comfort and patient care.